Type 1 diabetes is an autoimmune disease, meaning your body's immune system mistakenly attacks the pancreas as though defending it against foreign invaders. Much research centers on finding the cause of type 1 diabetes and better diabetes treatments. Recently, scientists have seen signs of hope for a possible diabetes cure using a tuberculosis, or TB, vaccine. After 2 decades of research done mostly in the lab, one study found that the TB vaccine, called Bacillus calmette-guérin, or BCG, triggered insulin secretion in rodents with type 1 diabetes. In type 1 diabetes, the body cannot produce insulin, so the ability of the BCG vaccine to stimulate insulin release was a promising sign. This discovery led another team of researchers at Massachusetts General Hospital to see whether the vaccine would have the same effect in humans. 6 people with long-standing type 1 diabetes were studied in a double-blind, placebo-controlled trial. Some individuals were given the BCG vaccine and others a placebo. The participants' blood was drawn once a week for 20 weeks and analyzed for biomarkers of pancreatic function and immune system activity. At the end of the study, researchers discovered that some of the people who received the BCG vaccine showed an increase in C-peptide levels, which are markers, or signs, of insulin secretion, as reported in the journal PLOS1, though the study was very small and much more research is needed to determine whether the BCG vaccine could be viable in treating diabetes. Researchers suspect that the vaccine stimulates the body's immune response and causes it to release a substance called tumor necrosis factor, or TNF. The body is known to produce TNF in response to the bacteria in the BCG vaccine. Years of research have indicated that TNF has a protective effect against autoimmunity and may prevent, slow, or stop the progression of some autoimmune diseases. In people with diabetes, TNF is thought to destroy the autoimmune cells that attack the pancreas and promote regeneration of healthy pancreas cells that can secrete insulin. So, is this the diabetes cure so many have been waiting for? This was an early pilot study of a promising approach to diabetes treatment, explains David Schoenfeld, Ph.D., one of the study's researchers and a professor in the biostatistics department at Harvard Medical School. We have found some evidence that we may be able to change the course of diabetes by an immunotherapy. However, we will need to do a great deal more work to confirm this observation and then to develop an immunotherapy that will be beneficial to patients. He uses the term immunotherapy rather than vaccine, Schoenfeld says, because although BCG is a vaccine for tuberculosis, it was used in this study to alter the patient's immune system rather than to prevent infection. The individuals in the trial who were given the BCG vaccine still relied on frequent, daily insulin injections to control their diabetes. The future of diabetes treatment: there is still a long way to go to find a diabetes cure or a vaccine for diabetes. It does not appear that a cure or vaccine for diabetes is realistic in the short term, the next 5 years, says Howard B.A. Baum, MD, an endocrinologist at Vanderbilt University Medical Center's Division of Diabetes, Endocrinology, and Metabolism. In the long term, however, it is my opinion that type 1 diabetes is a curable disease. Stem cell research could play a role, but so could other methods. The most promising avenue at this point is the concept of replacing the insulin-producing beta cells of the pancreas via transplantation, Dr. Baum explains. One approach in the future, which might provide an unlimited supply of beta cells, would be through stem cell research. Attempts to treat type 1 diabetes by blunting the immune system's attack on the pancreas, as the BCG vaccine might do, have failed in trials to date, notes Baum. That said, these strategies could theoretically offer a way to preserve insulin production in the future.